Meanwhile, the Department of Health says there have been no recorded outbreaks of diseases in areas affected by Typhoon Yolanda. Also, health risks remain high. Health Secretary Enrique Ona said such health risks include diarrhea, respiratory illness, leptospirosis, and influenza. He said the DOH is also making sure that there is proper water filtration for safe drinking water and that sanitation such as hand washing before eating is observed to prevent waterborne diseases. Added details from Freddie Abando.
The Department of Health's deployment of its medical teams and resources has reached all areas devastated by Typhoon Yolanda, despite the lack of logistics. C-130 planes of the Philippine Air Force airlifted supplies to include medicines, medical equipment, food, tents for shelter. Private airlines and planes provided backup flights as the mission to save lives intensified. Medical teams from the country's top medical centers are also engaged in the massive humanitarian mission. 5 mobile clinics travel from Manila to the affected areas by land crossing the San Juanico Bridge from Samar to Leyte. Medical tents are in place, especially in areas where hospitals were destroyed by the typhoon.
We are also preparing the trip of 5 buses with medical team and staff, essentially with their supplies that will be traveling to Calbayog by maybe later part of today or tomorrow, and they are going to be assigned to go around eastern Eastern Samar as well as Eastern Leyte and look at those towns that have not been reached by information or by medical teams most likely, and at the same time we are making sure that our logistical system is such that they will be adequately supplied and that they are also protect.
Health Secretary Enrique Ona stressed all measures are being undertaken to prevent the outbreak of any disease or sickness. These include medicines, especially antibiotics, to treat injuries of victims hurt by rampaging waters and falling debris. Children are given top priority to lessen their vulnerability to sickness caused by exposure to the effects of bad weather.
So far, wala pa kaming nare-receive na reports of outbreaks, but those are, yung question mo, those are the diseases that we are monitoring very closely, meaning diarrhea, fever, pneumonia, skin diseases, and we also have already distributed for medicines for prevention of leptospirosis.
In the meantime, there is sufficient supply of body bags. On-a-beard measures are being undertaken to prevent the spread of any disease caused by decomposing dead bodies.
Things are moving better. I'm sure they have now received at least 1,000 body bags. That has been quite difficult to bring during the past 4 days, and we have an additional
50 pounds of medical equipment.
also another 10,000 even body bags, of which we will probably base it initially here and distribute it further as the need arises.
For the People's Television Network, this is Freddie Abando reporting.